Your knees hurt when you stand up. They ache when you climb stairs. Maybe they even keep you awake at night. And here's what nobody tells you. The pills you're taking might be making it worse. A recent analysis showed that over 60% of adults over 60 are taking pain medication daily for joint discomfort, but less than 15% ever address the actual mechanical problem causing the pain. You're treating the alarm instead of putting out the fire. What if I told you there's a 10-second technique used in Japanese physical therapy clinics that can interrupt the pain signal in your knee joint almost immediately, and it requires nothing but your 2 hands and a chair? No prescriptions, no equipment, no side effects. And it works by doing something Western medicine almost never teaches: creating space inside the joint capsule where inflammation has compressed the tissue. Today, I'm walking you through 10 simple movements and pressure techniques that Japanese longevity practitioners have used for generations to keep their knees healthy well into their 80s and 90s. These aren't stretches. They're not exercises in the way you've been taught. They're mechanical resets that change the pressure, the fluid flow, and the nerve signaling in your knee in seconds. And I'm going to show you exactly how to do each one, in order, so that by the end of this you'll have a complete daily routine that takes less than 8 minutes. Now, number 10 might surprise you because it involves your ankles, not your knees. And number 1, it's the 10-second knee press I mentioned. And when you learn the exact hand position and the breathing pattern that goes with it, you'll understand why people report feeling relief before they even stand up. But we need to build the foundation first, because doing number 1 without the earlier steps is like trying to open a locked door without turning the handle. Before we go further, drop a comment and let me know. How old are you? And how long have you been dealing with knee pain? Just your age and the number of years. I read every single one and it helps me understand who's watching. Let's start with number 10. This one is called ankle circling with resistance, and in Japanese therapy it's part of a concept called kansetsu yurashi, which translates to joint loosening. Your ankle and your knee are connected by fascia, tendons, and a nerve pathway that runs up the outside of your lower leg. When your ankle is stiff, your knee compensates. When your knee compensates, it twists slightly with every step, and that twist grinds cartilage. Here's why that matters. Cartilage has no blood supply. It gets nutrients from something called synovial fluid, which is squeezed in and out of the cartilage like a sponge every time you move. But if your movement is twisted or restricted, that fluid doesn't circulate properly. The cartilage starves. It dries out, it cracks, and once it cracks, every step hurts. Data from orthopedic centers tracking joint health in older adults shows that restricted ankle mobility is present in more than 70% of patients who develop knee osteoarthritis. It's not the cause of everything, but it's a massive contributor that almost nobody addresses. Let me tell you about Margaret. She's 67, a retired school librarian in Ohio, and she came to me because her right knee had been hurting for 3 years. She'd tried physical therapy twice. She'd done cortisone injections. She was taking ibuprofen every morning. I watched her walk across the room and immediately noticed her right ankle barely moved. It was locked. I asked her to sit down and do the ankle circle test, and she couldn't make a complete circle without her foot jerking. We spent 2 weeks just working on her ankles. Every morning, every evening, she did slow, deliberate circles with resistance. Within 10 days, her knee pain had decreased by half. Not because we fixed her knee, because we unlocked the chain. Here's how you do it. Sit in a firm chair with your back supported. Lift your right foot off the ground, knee bent at 90 degrees. Now, using just your ankle, draw the largest, slowest circle you can with your toes. Imagine you're drawing on the ceiling with a piece of chalk attached to your big toe. Go clockwise for 10 circles, then counterclockwise for 10. The key is resistance. As you circle, gently press your toes forward as if you're pushing against something. That activates the muscles in your shin and calf, which pumps fluid up toward your knee. Do this twice a day, both ankles, even if only one knee hurts. It takes 90 seconds. If your ankle cracks or pops, that's okay. You're breaking up adhesions. If it feels stiff, go slower. Never force range of motion. Let it expand naturally over days. Now, here's the bridge. Your ankle is the base, but the next step is your kneecap itself, because that small bone is the single most neglected structure in joint pain, and when it doesn't glide properly, everything downstream suffers. Number 9. Kneecap mobilization, or in Japanese, shitsugai ugokashi. Your kneecap sits in a groove at the end of your thigh bone, and it's supposed to glide up and down and side to side as your knee bends and straightens. But over time, scar tissue, inflammation, and muscle imbalance pull it off track. It gets stuck, and when it's stuck, it grinds against the cartilage underneath with every step. Most people have no idea their kneecap isn't moving correctly because the pain doesn't come from the kneecap itself. It comes from the friction and pressure it creates inside the joint. Specialists in joint mechanics have noted that limited kneecap mobility is found in a significant majority of chronic knee pain cases, yet it's rarely the first thing assessed in a standard exam. This is a simple test. Sit down, legs straight out in front of you, muscles relaxed. Place your fingers on top of your kneecap and try to wiggle it side to side, then up and down. It should move at least half an inch in each direction. If it barely budges, you found part of your problem. I worked with a man named Robert, 71, former electrician from Pennsylvania. He'd had knee pain for 5 years and had been told he'd need a replacement within 2 years. His kneecap didn't move at all. It was glued down by tight quadriceps and scar tissue. I taught him this mobilization technique, and he did it 3 times a day for 4 weeks. His pain dropped by 60%. His orthopedist was stunned at his follow-up. Robert still has his original knees. Here's the technique. Sit with your legs straight, completely relaxed. If your muscles are tense, this won't work, so take 3 deep breaths first. Place your thumb and fingers on either side of your kneecap. Gently push it to the left, hold for 3 seconds, then to the right. Then push it toward your hip, hold, then toward your ankle. Do 10 repetitions in each direction. The movement is small and you're not forcing anything. You're teaching the tissue to let go. Do this every morning before you stand up and every evening before bed. Pair it with the ankle circles. You're building a rhythm, and rhythm is what Japanese longevity practices are built on. Consistency, not intensity, but mobilizing the kneecap is only half the equation. Now you need to wake up the muscle that stabilizes it, and that's where number 8 comes in. Number 8, the VMO squeeze, targeting the vastus medialis obliques. That's the teardrop-shaped muscle on the inside of your thigh, just above your knee. It's the only muscle that pulls your kneecap inward to keep it centered in its groove. And in most people over 60, it's asleep. It's not torn. It's not damaged. It's just not firing. When your VMO doesn't activate, your kneecap drifts outward, rubs against the outer edge of the groove, and creates pain on the inside of your knee. You feel it when you walk. You feel it when you stand from a chair. You feel it on stairs. And here's the kicker. Traditional exercises like leg lifts or squats often don't. Wake it up because your other quad muscles take over. Physical therapists, specializing in knee rehabilitation, have found that targeted VMO activation can reduce anterior knee pain in older adults significantly, often within just a few weeks of consistent practice. I'll tell you about Linda, 64, a retired nurse from Arizona. She couldn't kneel. She couldn't garden. Her knees hurt so badly she'd stopped walking her dog. When I had her try to contract her VMO, nothing happened. The muscle didn't even twitch. We spent 2 weeks doing nothing but VMO squeezes, and by week 3, she was walking 2 miles a day, pain-free. Here's how you do it. Sit in a chair, foot flat on the floor. Roll up a small towel and place it under your knee so your knee is slightly bent. Now, without moving your leg, try to press the back of your knee down into the towel. As you press, you should feel a tightening in that teardrop muscle on the inner thigh. If you don't feel it, place your hand there and press gently inward as you squeeze. That tactile cue helps your brain find the muscle. Hold the squeeze for 5 seconds. Relax for 3. Repeat 10 times. Do this 3 times a day. It feels like nothing. It looks like nothing. But within a week, that muscle will start to wake up, and your kneecap will start to track properly. You're 3 movements in. Ankle unlocked. Kneecap mobilized. VMO activated. Now we go deeper, and this is where it gets interesting, because number 7 addresses something most people never consider: the back of your knee. Number 7. Posterior knee release, or ura hiza nobashi in Japanese, which means back knee extension. The back of your knee has a complex web of ligaments, tendons, and a thick capsule of connective tissue. When you sit a lot, which most people over 60 do, that tissue shortens. It tightens, and it pulls your knee into a slightly bent position even when you think you're standing straight. This is called a flexion contracture, and it's incredibly common. You might not even notice it, but if you can't fully straighten your knee when you're standing, you have one. And every degree of lost extension puts extra load on your kneecap and your cartilage. You're walking uphill even on flat ground. Some analyses suggest that even a 5-degree loss of knee extension can increase the force on your knee joint by 20% with every step. Multiply that by 5,000 steps a day, and you see why pain develops. Thomas, 73, a retired firefighter from Texas, couldn't straighten his left knee for 4 years. He thought it was arthritis. It wasn't. It was soft tissue contracture. I taught him this release technique, and within 3 weeks he gained 12 degrees of extension. His pain dropped by half. Here's the method. Lie on your back on a firm surface, like a yoga mat on the floor or a firm bed. Place a rolled towel or a foam block under your ankle so your heel is elevated about 6 inches. Let your knee relax completely. Gravity will start to pull it toward the floor, stretching the tissue behind the knee. Stay there for 3 minutes. Don't push. Don't force. Just let time and gravity do the work. As the tissue releases, you can add a gentle downward pressure with your hand on top of your thigh, just above the knee. Press for 10 seconds. Release. Repeat 5 times. Do this once in the morning and once at night. You'll feel a stretch, maybe even a bit of discomfort, but not pain. If it hurts, reduce the height of the block under your ankle. This is a slow process. You're remodeling tissue that's been short for years, but it works. And when your knee can straighten fully, everything else we're doing becomes twice as effective. Now we're at the halfway point, and this is where I want to pause and ask, have you ever been told you need knee surgery? Or that your cartilage is gone and there's nothing you can do? Drop a comment and let me know. I'm curious how many of you have heard that line. Number 6. The quadriceps soft tissue sweep. Your quadriceps muscles run from your hip to your kneecap, and they're the primary shock absorbers for your knee joint. But in most people over 60, these muscles are tight, knotted, and full of trigger points. You can't see them, but you can feel them if you press into the muscle. They're like little rocks under the skin. These trigger points restrict blood flow, limit muscle contraction, and send pain signals to your knee even though the problem is 6 inches up your thigh. Massage therapists and manual therapists working with older adults routinely find that releasing quadriceps tension reduces knee pain faster than almost any other single intervention. I'll tell you about Karen, 68, a retired accountant from Michigan. She'd been doing knee exercises for months with no improvement. I pressed into her quads and she nearly jumped off the table. They were so tight she couldn't tolerate even light pressure. We spent 3 sessions just releasing her quads, and by the 4th week, her knee pain was 70% better. Here's what you do. Sit in a chair, leg extended. Using your knuckles or the heel of your hand, slowly sweep from the top of your thigh down toward your kneecap, pressing firmly into the muscle. You're not rubbing the surface. You're sinking in and dragging the tissue. When you hit a tender spot, pause. Hold pressure there for 20 seconds while you breathe slowly. The tenderness will decrease. Do 3 passes on the outside of your thigh, 3 down the front, 3 on the inside. It takes about 4 minutes per leg. Do this every evening while you watch TV. Pair it with the posterior knee release. You're building a routine, and routines are what create change. But here's the transition. Tight muscles cause pain, Yes, but weak muscles cause instability, and instability causes even worse pain over time. That's why number 5 is critical. Number 5, the single leg balance hold, or katashi de tatsu. In Japanese, meaning standing on one leg. Balance is not just about preventing falls. It's about forcing every stabilizer muscle in your leg, hip, and core to activate in real time. And when those stabilizers fire, they take load off your knee joint. Studies on aging populations have shown that people who can balance on one leg for at least 10 seconds have significantly lower rates of knee and hip pain compared to those who cannot. Balance training is joint training. But here's what most people get wrong. They try to balance on their painful leg first, and they give up because it hurts. You need to start on your good leg, build the neural pattern, then transfer it to the weaker side. I worked with a woman named Diane, 69, former teacher from Oregon. She couldn't balance on her right leg for even 3 seconds. Her knee buckled every time. We started with her left leg, which was strong. She practiced until she could hold 20 seconds. Then we moved to the right. Within 2 weeks, she was up to 8 seconds, and her knee pain had improved noticeably because the muscles were finally doing their job. Here's the protocol. Stand next to a counter or a sturdy chair. Lift your right foot off the ground, knee bent. Don't lean. Don't twist. Just stand tall on your left leg. Start with your hand lightly touching the counter for safety. Hold as long as you can, up to 30 seconds. Rest, then repeat 3 times. Then switch legs. Do this every morning after you brush your teeth. Habit stacking is the secret to consistency. When balance improves, try it with your eyes closed for 5 seconds. That's advanced, but it's the gold standard. And here's the insight. Balance forces your brain to talk to your knee. Most knee pain in older adults is partly neurological. The brain has stopped trusting the joint, so it tightens everything around it. Balance retraining rebuilds that trust. But trust isn't enough if the joint is still inflamed, and that's where number 4 comes in. Number 4, the cold compression reset, or sumitai ashuku in Japanese. This is not icing your knee after a workout. This is a deliberate, timed protocol that reduces swelling, numbs pain signals, and triggers a rebound increase in blood flow that delivers healing nutrients to the joint. Most people ice their knees wrong. They leave the ice on too long, or they do it at the wrong time, or they don't pair it with compression and they wonder why it doesn't help. Research on inflammation management shows that cold applied with compression for the right duration can reduce joint swelling measurably and provide hours of pain relief. I'll tell you about James, 72, a retired plumber from Florida. His knees swelled every afternoon. He'd been icing them for 30 minutes at a time with no improvement. I taught him the 15-minute cold compression protocol, and within a week, the swelling stopped. Here's how. Fill a plastic bag with ice and water, not just ice because water conducts cold more evenly. Wrap it in a thin towel. Sit down, elevate your knee on a pillow so it's above your heart, and wrap the ice pack around your knee with an elastic bandage snug enough to feel pressure but not so tight it cuts off circulation. Set a timer for 15 minutes. Not 10, not 20. 15. When the timer goes off, remove everything and let your knee return to room temperature naturally. Don't immediately move or walk. Rest for 10 minutes. Your knee will flood with warm blood, and that's when healing happens. Do this once in the late afternoon or early evening, especially if you've been on your feet. Pair it with the quadriceps sweep while you're sitting there. You're stacking techniques, and that's how you compound results. But reducing inflammation is only part of the equation. You also need to create space inside the joint, and that's what number 3 does better than anything else. Number 3, the seated knee traction pull, or hiza wo nobasu in Japanese, which translates to knee lengthening. This technique uses your own hands to gently pull your shin bone away from your thigh bone, creating a tiny gap inside the knee joint. That gap allows synovial fluid to flow in, reduces pressure on the cartilage, and can stop pain almost immediately. This is used in Japanese manual therapy clinics for patients with severe arthritis, and it's shockingly simple. Manual therapists report that even a small amount of traction can relieve pain in cases where medication had failed, especially when done consistently. I worked with a man named Paul, 75, a retired mechanic from Illinois. He'd been told his cartilage was bone on bone and he needed surgery within 6 months. I taught him this traction technique and he did it 3 times a day. 4 weeks later, his pain had dropped from an 8 out of 10 to a 3. He walked without limping. Surgery was canceled. Here's the method. Sit on the edge of a firm chair, feet flat. Bend your right knee and place both hands around your shin, just below the knee. Now, gently pull your shin toward you while keeping your thigh still. You're not yanking. You're applying steady, light pressure for 10 seconds. You might feel a subtle release or a slight pop. That's normal. Relax, then repeat 5 times. Do this before you stand up in the morning, after you've been sitting for a while, and before bed. It takes less than 2 minutes per knee. If your hands aren't strong enough, loop a belt or a yoga strap around your shin and pull with that instead. This is one of the most powerful techniques in this entire sequence, but it only works if the muscles around your knee are relaxed first. That's why we did the quadriceps sweep and the posterior release before this. You're preparing the tissue. Now we're getting close to the top. And number 2 is going to surprise you because it's not about your knee at all. Number 2, the hip flexor release walk, or koshi wo nobasu aruki in Japanese. Your hip flexors are the muscles at the front of your hip that lift your leg when you walk. And in most people over 60, they're chronically tight because of sitting. When your hip flexors are tight, your pelvis tilts forward, your lower back arches, and your knee has to hyperextend with every step to keep you balanced. That hyperextension slams your kneecap into the groove and grinds cartilage. You're destroying your knee with every stride, and you don't even know it. Biomechanics researchers studying gait patterns in older adults have found that tight hip flexors are present in the overwhelming majority of patients with chronic anterior knee pain, yet they're almost never addressed in standard care. I'll tell you about Sandra, 66, a retired postal worker from Georgia. She'd had knee pain for 8 years. She'd tried everything. I watched her walk and saw immediately that her hips weren't extending. Her knee was doing all the work. We spent 3 weeks releasing her hip flexors, and her knee pain disappeared. Here's the technique. Stand facing a wall, hands on the wall for balance. Step your right foot back into a lunge position, but keep your back heel on the ground. Now, squeeze your right glute and gently press your hips forward until you feel a stretch at the front of your right hip. Hold for 30 seconds, breathing slowly. Don't arch your back. Keep your core tight. Repeat 3 times per side. Do this every morning before you start your day and every evening before the cold compression. This is non-negotiable. Tight hip flexors will undo everything else you're doing. But here's the thing. Everything we've done so far has been building toward this final technique, because without it, the relief you get from the other 9 will fade within hours. Number 1 is the reset button, and it's the one you'll use every single day for the rest of your life. Number 1, the 10-second knee press, or Hiza no Atsuryoku in Japanese, which means knee pressure point. This technique targets a specific spot on the inside of your knee, where a major nerve pathway and a cluster of mechanoreceptors sit just under the skin. When you apply firm, focused pressure to this spot with the right hand position and the right breathing pattern, you interrupt the pain signal traveling to your brain and you trigger a release of natural anti-inflammatory compounds in the joint. This is not acupressure. This is not massage. This is mechanical neurological intervention, and it works in seconds. Practitioners trained in Japanese manual therapy techniques use variations of this in clinical settings with patients who have failed conventional treatment, and they report immediate reductions in pain intensity. Let me tell you about Arthur, 78, a retired engineer from Colorado. He'd lived with knee pain for 12 years. He couldn't walk more than a block. I taught him this 10-second press, and the first time he did it, his pain dropped from a 7 to a 2 within 30 seconds. He looked at me like I'd performed magic. It's not magic. It's anatomy. Here's exactly how you do it. Sit in a chair, knee bent at 90 degrees, foot flat. Find the soft spot on the inside of your knee, just above the joint line, below the big bulge of your inner thigh muscle. Press into that spot with your thumb, firm enough that you feel pressure but not pain. Now take a slow breath in through your nose for 4 counts. Hold for 2 counts. As you exhale slowly through your mouth for 6 counts, press a little deeper. Repeat this breathing and pressing cycle 3 times. 10 seconds total. When you stand up, your knee will feel different. Lighter, quieter. The pain won't be gone completely, but it will be less. Do this every time you stand up from sitting, every time you feel a flare of pain, and every night before bed. It resets your nervous system. Now here's the rhythm. Every morning, ankle circles, kneecap mobilization, VMO squeeze, posterior knee release, hip flexor stretch, balance hold, 10-second press. That's 6 minutes. Every evening, quadriceps sweep, cold compression, seated traction, 10-second press. That's 12 minutes. Total daily time, 18 minutes. That's less time than it takes to watch 2 commercials. You don't need pills. You don't need injections. You don't need surgery unless the structure is truly destroyed, and even then, these techniques will improve your recovery. What you need is consistency, and consistency is a choice you make every single day. Your knees are not broken. They're compressed, inflamed, and stuck in a pattern that you've been repeating for years. These 10 techniques break that pattern. They create space, they wake up sleeping muscles, they calm down angry nerves, and they teach your body to move the way it was designed to move. So, here's my question for you, and I want you to comment your answer. Which one of these 10 techniques are you going to start with today, and why did you choose that one? I read every comment, and your answer might help someone else who's struggling with the same pain you are.